Good. It's good evening or good afternoon. It's either way. In America, I suppose it's good afternoon. In the UK, it's good evening. If I'm going to try to set up or share the platform, so hopefully we will get many people onto it if I can share. So today we have a special program, and it's all about class 4 laser, and we have a special guest as well. The guest is Dr. Zuckerman. He's a podiatrist and also a laser expert, I would say. So let me introduce to Dr. Zuckerman, and I'm sure he can introduce himself. And before I do that, please be aware that this is a live session. There are no script, right? We are human beings. We could make a mistake. For that purpose, I would a disclaimer in advance. If we do that, please forgive us for on that aspect. Um, in life, we all learn. There's no absolute without learning it. Every day we learn. Every day things are different. So, and if anybody want to ask questions, you can, but you need to come to my Facebook platform. Otherwise, I am sharing in many platforms, so I won't see what other people are saying or doing. So please come and ask questions onto my Facebook platform. And as I said, we will enjoy today. It's all about indication and contraindication. It is more or less important that we understand, especially on class 4 laser treatment, about indication and contraindication. And Dr. Zuckerman would be an ideal person for that. Good afternoon or good evening, Dr. Zuckerman. If you could introduce yourself, and then we shall kick off. It's, by the way, it's 11th of May, Tuesday, 2021. Thank you, Dr. Zuckerman, your platform.
Thank you very much. I know we have limited time, and I want to spend my time on involving. I love the way you say it's education. Education is a discussion because we learn from each other. I've been in the teaching of lasers and designing and manufacture of lasers in the United States for it's well over 15 years. I don't count it anymore. I've been involved with the Remy laser for 3 years. There's over 300 of these Remy lasers in the United States, and the feedback, it's the best laser I've ever had. And I've worked and consulted with K laser, Diawave, Aspen. I don't know if these mean anything, but I know K laser is very popular. I've taken the best of every one of these lasers and come up with the Remy. And I just want to go over some brief things. I use a mnemonic, PPMA. A laser should be, and this is the Remy. It meets all these criteria. Powerful. It's a 30-watt laser. It should be portable. The Remy is only 4 pounds. It should be multifunction. The Remy does pain, which we'll talk about. Pain is phenomenal. Pain is just an area that has it's changing the way. Today people don't love injections. If you find a patient that comes in and loves to have an injection, you better check their mental capacity there, because but they don't have to take. We're getting older. People are living longer. They're on lots of medications. Lasers are non-invasive. They have very little side effects, which we're going to talk about. But I want to go over what I call a matrix. When do you use the laser? And we're going to talk about pain right now. There must be inflammation present. There must be arthritis. Any one of these: inflammation, arthritis, pain, lack of mobility. The Remy also does fungus toenails. It does warts with or without aesthetics. It's FDA cleared for surgery and therapy, both of it. That's the beauty of it. It's multifunctional, has a tremendous foundation. But everybody talks about contraindications, and I want to use the word relative. And I'm going to talk about the things I think that are important, review other things. I will make available, and it's an article that I've been using. It's a short article, but the importance of this article was printed in Practice Pain Management. It's a pretty popular journal. It was published, and the reason why I want to make this available, because you will get this, anybody that writes to Sumis, I will make it available to him. But it's something, it's simple, it's short.
Okay, thank you. Thank you very much, David. Like as I said, like you said, it's education. And with the laser system, it's about affordability and test of time. It's evidence-based, well as you have experimented or had hands on laser for a long, long time. And then you decided to bring that into a practice and available to not only for the podiatrist, even for physios, sports practitioners, surgical people, surgical profession, I mean, and so on. Before we do that, like as I said, a little bit of laser. Right. It's got body on set program. Welcome, the power of class 4 laser. Thank you, David. Now we can start. First of all, I'd like to start off with the indications. What are the indications for the class 4 laser?
Okay, well, specifically for the Remy, because class 4 lasers are different. Not every class 4 laser is multifunctional, and the Remy is very functional. So if we're talking about pain, I think pain, when I say pain, I'm talking about tendonitis, fasciitis, neuromas, arthritis, physical therapy, trauma, sports medicine. There's just so many areas. But the one thing people ask, can you use it for this? Can you use it for that? So I have a little mnemonic. If there's inflammation present, pain and or arthritis, lack of mobility, these are the things. For example, plantar fasciitis. The itis is inflammation. Obviously, there's pain. You can, when somebody has plantar fasciitis, a lot of times they have what we call an equinus, a shortness of the Achilles. And training and education are important. Just to have a laser is one thing, but the education, we provide CME credits and certification. So it's just not you buy the laser and you're done. You need continuing education. And we're there to, both of us are there to support you. It's very important, support with experienced podiatrists that use it every day. And I don't know what to say about. To me, it's second nature. But I like to talk to doctors and new Remy lasers that we're here to. I guess you could use the word hold your hand. We teach you the basics. We train you. It's not one training, you're done. If you have a question, we're here to answer for you. We're here to help you because I want you to be successful. Because if you're successful, you have happy patients. It's all about patients, getting patients better. That's the key to why I'm even here today. There's nothing like a satisfaction of patients saying, oh my God, I can't believe, I wish I had known about this before. And that's what this is all about. Fortunately, with social media, I'm amazed at the social media expertise that you have, Sumis. It's amazing. I've never done anything like this before. I usually do short little videos that I put out, which anybody is welcome to see them. We have them on YouTube, but I don't want to drift a little bit because I know if you can direct me on what areas you want to talk about.
I would, with the social media, as I said, I also found the social media by accident, right? And I believe like live interaction is far better sometimes. Yes, it's not perfect world. There's a lot of things we say garbage, but that's live. Live means there's no script. You're not making things up. Whatever it's coming from your mindset and so on. And that is nice learning. We are not perfect. The world is not that perfect. So I believe that if you see something raw, you enjoy it. And also people, I give them chance to interact because I am learning from them. I am learning from you. So therefore, that's why I believe that, especially today's program, because there are many type of laser in this earth, and there are, each laser has its own protocol. But the most important thing I need to find out is I had a question once done, given by one of my colleagues. Can they treat? That's why this program was designed about contraindication mainly, right? Can they treat severe disease for a 13 or 14 years old boy? Because literature, there are a few literature quite miss or misbags. So I want to understand from you, what is there a contraindication, or is it safe enough to treat those sort of conditions?
Well, it's interesting you pointed that out to me. And years ago, this is not a new article, but you'll see, there's a lot of quote fake news or fallacies out on the internet, so you get confused. So I want you to go back, apophysitis or epiphysitis in a child. You're not going to close the growth plate. That's been tested. When I make comments, and that's why I want you to read this, because there's studies where they actually did it for Osgood-Schlatters disease. They've done this and they've reported on this. So it's based on evidence. There's inflammation. In fact, there's studies that show that there's much better outcomes with the laser as opposed to, what child do you want to put in a boot cast? You want to tell them to go sit down and not play. And soccer is very important. Soccer is very big. I find a lot of soccer kids, it's mainly soccer. I don't know what you have found, but it's very, the growth plates are open. They're not, they have a tendon, specifically apophysitis or Kohler's disease, even Freiberg's disease. There's all inflammation. Now we're talking about the acute phase. Sometimes you get into the chronic phase where there's actually damage and degeneration. You have to make the right diagnosis, but it's very effective, and that's why I like this article, and I brought it out because it's part of the training, in that it not only tells you that it's not contraindicated for apophysitis, but why, and the evidence and studies that support it. In your first mind, you may say, well, we'll close the epiphysis like a fracture. No, yeah, if you do 200 treatments, it might, but we're talking, 10, 15. How many treatments do you really need to treat the child? But the answer is no, and the evidence supports it. I can read some of these outcomes to you, but I want you to read them because we have a lot to cover. So the answer is no. It's all relative. Now, you're not just treating apophysitis, you're treating the child or the patient. So you have to make a reasonable judgment. If you feel that the child is overweight, there's biomechanic situations with it. There's lack of proper warming up and stretching. It's the lasers is a part of the treatment plan, but the answer is no. Apophysitis is no. Another, and I'm going to expand on this in other areas. I'm going to go over the areas, and I'll just pregnancy. I would not treat in pregnancy, but they have treated it in women that are pregnant, not right over the abdomen. You have a lot of people who have lower back problems. They have done that. Another thing was the thyroid gland. They actually were taught never use it over the thyroid gland. Okay,
yes, that's what I read.
They have treated there's never been proof that I would avoid it. But if you're treating a thyroiditis or a thyroid condition, that's a whole separate area. We're talking about don't treat it over the thyroid when you're treating cervical pain or shoulder pain. But they do have studies showing where they've used it, where it's improved the function of the thyroid gland. So, when you say the thyroid gland, why wouldn't you do it? Because the thyroid's normal. Okay, you're treating other things. You don't want to hold it over, but as we're not medically treating the thyroid gland, and that's key. I wish I had been able to, this was a little short notice. I wish I was able to get this article so we could discuss it together, like a book club. Maybe sometimes we could do.
There's always next time, and there's always learning every day. So that would be good for next session or next education.
And I want to go around diabetes. Oh my God, Don't treat diabetes. Well, that's not true. If a person has a wound, therapy lasers were initially used, and they still are, to treat non-healing wounds because they create neovascular conditions. It produces a neovascularization. It reduces the bacteria flow to it. You actually get increased blood flow. There's a study that they talk about in this article showing how it after they used the laser increased hyperemia post laser for 45 minutes afterwards. So like a Raynaud's.
David, this was the my colleague Gyno who recently was introduced to Remy laser. So she's thanking you for the information. Right. Thank you, Gyno.
I appreciate it. We're always here to answer it to you. I will make sure you get this. This article is, I don't know what year it was published in. It has not changed. I'd have to look it up. It was in 2019 is when it was published. But the internet, these are things that they've never been tested. But there's also a common sense to it. I'm going to tell you my contraindications.
Yes, please.
Yeah, person has, we typically will use the handpiece in a contact position against the skin. Now, if the patient has dried, cracked skin that can tear very easily, obviously you don't want to do that. You don't want to put it against it. You could rip the skin, so you go off of it. Okay. You should never hold the laser in one spot for more than 2 seconds. It's very rare to get a burn. But if you hold this in one spot and the patient has zero sensation, you need feedback. So you're holding it here for, minutes, anywhere from 5 to 10 minutes, and they don't feel the heat, you could burn them. So I don't like, and we can talk about neuropathy at another time, but you want to stay away from especially on the top of the foot or the anterior surfaces where the skin was very fragile and thin. You could either rip it. If a patient has zero sensation, there is a potential again where you could burn them, but you'd have to have no common sense. It'd be holding it in one spot for a long period of time. Another thing is that the Remy laser has features in it. Never shut off the beeping. Never shut it off, because I once had a doctor, he did get a slight burn because he was talking to the patient. My rule is you turn it on, and when you turn it off, you take it off. He's talking to a very well-known doctor. He's holding it, and a patient had zero sensation and or very little sensation, and he didn't know the laser was on. This may sound stupid, but just because the beam is on doesn't mean the laser is working. And so you have to follow. There's many. See, when you go through FDA approval, and that's different about the Remy, is that it's met the safety standards and built-in safety standards that the FDA, and FDA is, we also have a CE mark and on the Remy, which is important, but you have to meet certain levels of safety reports. And the Remy's been through all of that. But those are things that you don't have to know about. It's been done for you. The Remy is a very safe, has very safe features in it. But you have to also, use your medical common sense. Why would somebody hold the handpiece on for 5 minutes and somebody has no sensation so they can't say ouch? I don't know why anybody would do that, but you're treating a patient. United States, it's one patient after another. So you have to use your common sense when you do that. Again, with the skin, I don't think it's ever written anywhere that, if you take it on the skin, a lot of patients are older and on Coumadin. Coumadin will make the skin very fragile and easy to rip. And if you take a handpiece, even though the Remy handpiece is very light, and we have a special glass plastic cap on this to make it nice and smooth, you put pressure on anything. If you rub your own hand that has fragile skin, it's going to rip. Have I seen that? No, but it's common sense. You got to use your common sense is what I'm saying.
Okay. Another thing about contraindication, it's about a dark skin against light skin. So I want to know about more on that, please.
Okay. Now, the Remy has a special program in there where you can adjust the weight and the skin. Now, it could get warm. We used to use a single wavelength, a 980 wavelength. It absorbed in the water. It could get very hot and around tattoos or dark skin. When you're blending it with the 980 and 810, it's less. It's much more comfortable. I've rarely seen it in dark skin, but in some tattoos, you want to try to avoid the tattoo. You might want to go. We have like I said, we have a special program in there where it can modify it. The chronicity, the pain levels, the skin levels, you can do that. But what I always say, if you're not sure, test it on yourself. test the laser on yourself to see the comfort. Know these, test it, use it on yourself so you're familiar with what the patient is feeling. So you know. That's
Okay.
important. Test it on yourself.
What about those patient may have a plate, say if they have a metatarsal break, they may have a plate, a metal plate.
Good point. That's a
Thank you.
very good point. There, it does not heat up the screws, pins, deep plates. However, they'll do surgery a lot of times because we use the Remy for post-surgical bunion surgery.
Yes.
You put staples in the skin and you go over it, not it's going to heat up the metal. If you have it right against the metal, of course it's going to heat it up. It's like putting a match. Is it the end of the world? It can be very uncomfortable. So that's common sense. Somebody said to me, when I say metals, it doesn't have any effect on metals that are internal. But a lot of, I don't know if they do that in the UK, but they'll use staples a lot of times to close the skin because we use a lot for physical therapy and post-surgical. Of course, you don't. If somebody has sutures, okay, you don't want to put it right in the sutures. One, it's going to be uncomfortable. You lift it off, non-contact.
Yeah, no, that's what my questions were. One of my colleagues, I said, because laser is used for post surgery, so if there's some implants in there, so but you don't go to the implant, you are treating the wound or you are treating the inflammation. So the laser should be used, like you said, expert knowledge, courtesy, understanding, and common sense. I'm sorry, that's the word I use, common sense, right? You got to understand.
I'd like to talk a little bit about post-surgical wounds and why you want to treat even a matrixectomy or a nail surgery or a wart surgery. It's what it does is it reduces excessive inflammation, and we know excessive inflammation can lead to scar tissue. Number one. Number two is you do have a bacterial reduction of surface bacteria. I have a podiatrist. He does a lot of surgery, and in some cases you're going to get redness, and he put them on antibiotics. It's completely eliminated when you use the Remy laser post-surgical, and it's a very short period. You're not doing it for a full 10 minutes. I had a doctor say it was uncomfortable. He was doing it on a patient. I said, if you're when in doubt, we have special programs. You go right to it, and you use those programs, and you punch in. What's the weight of the patient? What's the skin? What's the chronicity? What's the pain of level? Here's a quote: working with a patient with ulceration, would you work around the area? That's a very good point. You don't do right on it. You go around it wider. You go wider. Okay. You just don't go around. You never do this on anything, whether it's neuroma or plantar fascia. You never just go short strokes. They're wide strokes. The Remy is a class 4 high powered laser. And it's only a minute treatment on wounds. 1 minute, 60 seconds. So you go around it wider. If the wound is this big, you're going to at least do it this big. Wider is okay. With
Thank you, Gaina. Thank you. Another excellent questions. I wish many people will participate. Probably 6 o'clock in the evening, and most of the people are free. Most of the podiatrists are free in the evening. But anyway, it's time constraint. We got 4 more minutes. Any absolute contraindication, Dr. Zuckerman?
Absolute contraindication. I would say at this point, unless you have a lot of experience, 0. If they have an anesthesia, no feeling at all, I would not do it as a beginner. You can, in neuropathy, you're going to have, when you treat neuropathy, which is an excellent indication, you're going to have decreased sensation. I stay on the bottom of the foot. Don't go on the top. If you get more advanced, then I teach you. I have found neuropathy, the key is most of the treatment is on the plantar surface. We teach to do the common perineal at the head of the fibula, the tibia, the tarsal tunnel, but the majority, I give the guideline, at least 60% should be on the bottom of the foot. I'll tell you another thing is that put your finger on it. And if you want to use your finger as your temperature, everybody has a different, temperature degree, but if they have 0 sensation at this point, I don't recommend doing the treatment until you have much more experience and comfort level and see the reactions to it. Again, if you're not sure of the heat is a vasodilatory effect, but it's a side effect of the laser. So you always keep it moving. You never hold it in one spot. It takes experience. And if you're not sure, you use our preset programs that guide you through the proper dosage, the proper frequencies. It's just touch, touch, touch.
So the final thought or final recommendation, or you assume, is laser is safe.
Absolutely safe. But it's safe because you educate yourself on how it works. The higher your education experience, it's safe. Again, somebody that would just shut off the beeping sound and not knowing it's on could burn somebody. You should never have the laser hold in one spot, and you only have it on when you're treating. You take it off the skin. My last thing is that, and I'll make this available, this article, it's an excellent education because it just doesn't list it. It tells you, it gives you references, it gives you studies to show you why you can treat in children, how many the cases and what happened. And the bottom, it's funny with it's not funny, it's important. With apophysitis, the outcomes were better with a laser.
Thank you, sir.
Always, I'll give you one other thing, and I know we're getting past this, is that whenever you read an article, go back to the original references and read them. Just don't read an article. Go back. I like reading the footnotes or the references, what we call bibliography. Go back to the original articles. Go deep into reading and educating yourself. Read the original source and come to your own conclusions. Is what I'm saying.
Thank you, Dr. Zuckerman. That was lovely to know about indication or contraindication in a short period of time. We're just touching the surface of it, but it's must to understand all this, and the common sense will prevail. And it's up to individual practitioner to assess, judge what sort of treatment will be suitable for them. And obviously, this sort of education will give you a little bit of knowledge where and what or whom to provide treatment and not to provide treatment. Again, whoever is listening to us, thank you again. If any question, anything else, you can either email me privately, or Dr. Zuckerman is there. You can always reach out with us without any problem whatsoever. And once again, thank you, and I shall see you next time.
Thank you. Appreciate it.
Thank you. Bye-bye.